How you doing, guys? Steve here again. Quick video before I go to sleep. I trying to go to bed at a normal hour. Well, trying to improve my sleep schedule, which is a pretty good tip for healing depression. Getting in a schedule, getting in a routine. You know, getting that's just something I've been doing just the last couple of days. But what I really wanted to talk to you about was getting yourself educated, getting knowledge. If you're bedridden and if you're couch ridden, if you can't get out of the house, if your depression, your anxiety is that bad, educate yourself. If you can't activate yourself physically, activate yourself mentally. Um, if you're going through benzo withdrawal, if you haven't heard of the Ashton Manual, please Google it. It has so much information on there. If your doctor is tapering you off too quickly, bring that into them. If they refuse, go to your primary care physician. Say, listen, doc, this is how I want to be taking off my medications. My psychiatrist doesn't trust me. And if they don't agree with that, find a different primary care. Um, my problem with my psychiatrist is she does not believe that my too rapidly of a taper of benzos caused my depression. I showed her the Ashton Manual. She agreed with some of it and denied the depression factor. Now, unfortunately, in this case, I would tell her to go fuck herself, but I can't. This is basically my last bridge I have within like a 50-mile radius on psychiatrists who accept my insurance. It's It was a shocker today when she said that I showed her my serotonin levels and how low they were because I had my own serotonin levels checked. You know, I'm being proactive on this, and like I said, I educated myself. I've been doing a lot of reading on different things, hormones and thyroids and vitamin levels and different things like glutamate, hypocysteines, and what else is there? The MTHFR gene in your brain. You know, there's so many things. Vitamin deficiencies. There's a list and list and list of things. Low folic acid, low vitamin D, low vitamin B's. A list of things that can mimic depression and anxiety, and I've been tested for most of them. My serotonin is extremely low. My norepinephrine's kind of on the low side. Epinephrine's still in range. It's normal for the average 20-something-year-old guy. Um, but I want you guys to educate yourself, especially if you're seeing a psychiatrist, because I trusted a doctor who had no idea what he was doing. And I feel personally it put me in this position of depression and more anxiety than I was before I even started medication. So do yourselves a favor and educate yourself. Go into your doctor's office and speak your mind. You're a human being. You're sitting across a desk or sitting on a couch or whatever you're doing, wherever you are in your doctor's office. You are human. You have your own mind. You can educate yourself. Go in there with guns blazing, you know. And if you don't like what that person has to say, don't burn your bridge if it's the last bridge you have. But don't take their word for it if you believe differently. I can go on and on about this all night. I saw my primary care physician. I told them all about my psychiatrist appointment, how she recommended shock therapy, while I still have more options to go. You know, because she thinks I'm running out of options, and how I've been on an antidepressant for a couple months and it still hasn't gone up. My serotonin levels still haven't gone up. I told my primary care physician today about all the stuff I've read on and all the new blood work I want. And he said, Steve, he said, after you're all healed, he's like, you should go to school to be a psychiatrist because you're already halfway there with all the stuff that you know. He's like, you know more than I do about psychiatry and medicine. So, kind of gave me a boost, kind of led me along the lines that I was on the right path. I've spoken to pharmacists, you know, been to plenty of pharmacists. I talked to them, you go to the consult desk at some pharmacies they have, ask questions, one pharmacist said, get my folic acid checked, get my vitamin B levels checked, vitamin D, so I did that. Going to get my folic acid tomorrow. I found out my vitamin B6 was low, vitamin D's were real low. She suggested check out your glutamate levels if they're too high. It could have something to do with depression, anxiety, hypocysteine levels. I'm not sure what those are, but those will play into the effect of your MTHFR gene, which can, if it's mutated in any way, can have a negative impact on your body, can increase depression. It's a enzyme or gene. It's like as far as I read, it's a precursor to the production of norepinephrine, epinephrine, dopamine, and serotonin. If that's the case, I'm having that test done. I'm seeing if I have that mutation. Anybody can have it. It can be inherited. If that's the case, I'd have to take special vitamins. So it's like I said before. Remember that you still are a person. You're not hopeless. You're not helpless. There's a answer for you out there, just like there's an answer for me out there. And we gotta take care of ourselves. Even though it's real hard, you educate the hell out of yourself. You find a way. You find a cure. You find the answer. It's out there. I know it's out there. That's why I'm still here. I'd be long gone if there wasn't an answer. I know I'm close. And I'm gonna keep on fighting. And I'm gonna keep on surviving. Just like I want you guys to do every day. You keep your head up, you keep fighting, you keep surviving, no matter how hard it is, because you're a winner and you're gonna beat this shit.